Dr. Nepute, you learn how to play piano like that, man. You're on your way, dude.
It's pretty impressive.
That's how that rolls right there. How are you doing, brother?
I'm doing well this morning. How are you doing this morning?
I'm doing great, man. I love you, dude. Happy New Year.
We love you, too. Happy New Year to you, too, man. You're doing a great job. I love it.
You too. I mean, you have done such great things for... You're so busy. You're so passionate. You remind me of President Trump. You're always up to something. You're always texting me about some new thing you're up to and how things are progressing that you've started. And you've been working on this non-opioid drip for people for concussions. You've been traveling all over the globe. And now we want to talk something very simply. A Nepute Wellness Center, folks, 2 locations. And it doesn't matter what your goal is, just basic nutrition, whether you have back pain, sinus issues, migraines, your kids are going through ADD, ADHD issues at school, and you want to figure this out, Dr. Nepute has it for you. We were talking a while back about preventing, because everybody's sick, man. Everybody's sick.
Yeah, it is, Jamie. I mean, I'm telling you, this has been, every time you turn on the news, it's flu this, flu that. I mean, there are so many folks that are missing school, that are missing work. I mean, it really is, it's bad this year. But here's the deal. I want to talk a little about that. I've been on local TV talking about it as well, just so people can get the truth about this. The reality is that it is nasty. It is going around. There's a lot of things happening, but there's so many things that can be done to boost your immune system to prevent this stuff. And if you do get some type of flu or flu-like symptoms, bacteria or virus, there are things you can do to lessen the time of the sickness. And Jamie, when I was, when we were on, Channel 2 the other day talking about it, I brought up the fact that, this is something that a lot of people don't realize. The flu, when you actually have the flu, so only about 4%, and this is according to the CDC, only about 4% of people that are out there right now who have flu-like symptoms really, truly have influenza A or influenza B. The vast majority of times people don't really have the flu. They have other respiratory infections, that mimic flu-like symptoms, whether it's bacteria or virus. So, doing your standard flu shot obviously is not going to work for that. That's like we talked about, the CDC says that the flu shot is about 15% successful in preventing and lessening the flu over the last 18 years. Well, I'll tell you what, if I only got a 15% in my, doctoral training, I wouldn't be a doctor right now.
Right, exactly.
You know what I mean?
Yeah.
So what we're trying to educate people on is what can you do to boost your immune system? What can you do to help yourself, your family, your friends, your loved ones, so they don't get sick? And then what can you do to help, reduce the time of the sickness if you get it? And Jamie, that's what we're all about, man. You know that.
Yeah, no doubt. I mean, and that's where, and I want to hold you over, if you don't mind, because I want to get to more of the nuts and bolts of prevention.
Sure.
But initially, and I know Pippi was, you were teasing Pippi because she said, well, I have a little bit of a cold. And you go, well, just Jameson and a cigar would be good for you right now. But really,
yeah, absolutely.
But really, in terms of knocking something down, can you give us one tip, and then we'll get into prevention just on the other side of this break. But
100%. If vitamin D as in dog, vitamin D3. If you want to research this, go to d3council.org. It's a website. And there's tons of research that shows that if you get a large enough amount of vitamin D3 in your system, you can reduce and or prevent respiratory infections, pneumonia, and influenza A and influenza B. That's a fact. So vitamin D3, and then it talks about the dosages that you can take based upon your height, your weight, all that, your age,
right,
all that kind of stuff, and it's on that site.
Because you got to be careful about it because it's fat soluble, right, or non-fat soluble.
Right. 100%. So you can get it's very hard, but you can get too much of it. That's why, Jamie, in my office is what we do is we always test. We don't guess, we test.
Yeah.
You come in, we draw blood, we find out where your levels are, and again, the research shows that if your vitamin D is above a 45, between a 45 and a 65, in some cases above that, depending upon your age, on your blood test, then your chances of getting flu or flu-like symptoms are non-existent.
All right. Well,
ever since I've known this, and the majority of my patients have known this, we just don't get sick anymore. That's all there is to it.
That's amazing. I love it. Well, hang on the line because I want to do a little more prevention with you before we get to Jennifer, but I just want to finish it up, the discussion with you. But check it out at NeputeWellness.com. Dr. Eric's a great guy. His staff is fantastic, and we can learn a lot from you, my friend, and we do. Just hang on the line, buddy. Appreciate you very much. It's Common Sense Radio. Dr. Nepute, by the way, keep in mind when Dr. Nepute talks about D and how it's great for prevention, great for attacks, when you suddenly get that cold attack, you got to be careful with it, and I suggest you pop down to Nepute Wellness because, Dr. Nepute, you have a nice little droplet formulation. You just drop a bit on your tongue and you're good.
Yeah, I mean, that vitamin D, Jamie, like you said, like getting your blood levels checked just to make sure that your vitamin D is between 40 and 60 nanograms per milliliter is probably the single most important and least expensive action you could take to avoid getting the flu. I mean, it's a fact. Nobody can deny that. So
yeah.
You're totally right, man. It's so inexpensive.
And so then ongoing, so in general prevention with D, what else can we do?
Well, a couple things. I mean, obviously, we want to keep our immune system boosted, so doing things like avoiding as much sugar and processed foods as possible. People don't realize, Jamie, that sugar impairs the function of the immune system, right, almost immediately. And another thing is getting plenty of rest. Just like most other things, if we're not getting good quality sleep, we're not healing. Another thing, and this is, another reason why we get, flu-like symptoms during this time of the year is we're overstressed. We're holiday season, all that stuff's going on, so try to minimize your stress. Exercise, which I know you're a big fan of, anything you can do to increase your circulation, your blood flow through your body is going to help. Another big thing is omega-3 fatty acids are awesome for boosting the immune system. And then, common sense prevention things, washing your hands. Let's not, let's try to avoid situations and places where people that have this kind of stuff. But here's the last thing I want to say, and then I'll answer any questions you've got. So let's talk about, I love when you talk about Common Sense Radio. I talk about Common Sense Healthcare. Well, if the flu was as bad as it's meant out to be, every person who gets exposed to it would be affected by it, right? Well, how come, one person can have the cold and be around 100 people and not everybody gets it? It's because those other folks' immune system are able to handle and fight it off. And so what I'm saying is make sure that your immune system is strong and make sure you do the right things to prevent it in the first place if possible. When you get it, there are lots of natural remedies you can do to alleviate it and prevent it from happening in the future.
Dude,
hopefully that makes sense.
Perfect. Don't forget Wellness Matters, Saturday afternoon at 3 o'clock. I need to get you on TV, if you don't mind, maybe on Thursday or Friday, just depending on your schedule. So we can talk more about this. I want to talk about ultimately vaccines as well, because there are some changes in those kinds of things in terms of mercury, that kind of stuff. But you have more information at NeputeWellness.com. Dr. Nepute, Happy New Year, buddy. We'll check in with you and get you on TV Thursday or Friday, depending on your schedule, bud, okay?
Sounds good, Jamie. Thank you, and I appreciate all you do, brother. Keep up the great work.
You're the best. Thank you. Dr. Eric Nepute, NeputeWellness.com.